My name is Dr Philippa Kaye and welcome to Cancer Explained. I'm here today with Dr Neel, who has experience in treating people with bowel cancer. People like me. I was 39 when I was diagnosed with colorectal or bowel cancer and have had multiple surgeries and chemotherapy, so I've been in your shoes. Let's talk about how it's treated, stage by stage. We're going to guide you through the most common symptoms to look out for, learn how people get a diagnosis and the treatment options available. Dr Neel, welcome. Tell us a little bit about yourself.
Thank you, Philippa. I'm a clinical oncologist and I specialise in treating patients with bowel cancer.
Let's go right back to the beginning. What is cancer?
So cancer is a disease that arises from your normal, healthy cells. These cells undergo an abnormal change, which we call a mutation, that leads to them growing uncontrollably. There are different types of cancer of the bowel, but the commonest type arises in the cells of the colon, which is here, and the rectum, which is here. And this is called colorectal cancer.
And that's the type we're going to be talking about today.
Yes. For information on cancers of the small bowel and the anus, you can look at our website.
So what are the main symptoms of bowel cancer?
So the symptoms of bowel cancer can be quite varied. You might find that you have some blood in your poo, for example. You could also have a change in your bowel habit.
But what's normal for a bowel habit?
So everyone's bowel habits are different. But if you find something that's unusual for you, so if you're more constipated or you have more diarrhea, and it lasts for longer than 3 weeks, for example, you could also have some other symptoms, weight loss that's unexplained, tummy pain, or the feeling that you're not quite emptying your bowel. But all of these symptoms could be due to things that are much less serious than cancer. So if you do find anything new, you should always see your GP.
Now, I was 39 when I was diagnosed with bowel cancer, and whilst often we think of people with cancer as being older, actually I know that we're seeing more and more young people with bowel cancer. Why do you think that is?
This is really interesting, and you're absolutely right. We are seeing an increase in the number of young people developing bowel cancer, and there's lots of research going on around the world to try and figure out why. We think it's because in the last 40 to 50 years there have been lots of changes in the way we live. Different in foods, processed foods, smoking, people are less active, and we think all of these things might be reasons why we're seeing early cancers.
Natalie was 36 years old when she was diagnosed with bowel cancer. Earlier, I spoke to her about those early signs and symptoms. Natalie, tell me a little bit about what your life was like before your diagnosis.
So before my diagnosis, I was a dancer, very active. I taught dance. I was a primary school teacher for a little while. So yeah, I had a busy life. Maybe about a year before my diagnosis, I had like subtle symptoms.
So what were the symptoms?
So discomfort when I ate, a little bit of bloating. I would say a little bit of like a nausea feeling when I was eating, low energy. They were like the early symptoms. And then it got progressively worse over the next, 12 months. Weight loss without trying. And the tiredness was, for me, one of the main symptoms. I was noticing the symptoms, but I was kind of saying, oh, it's fine, there's an explanation for it, until it got to probably maybe 4 months before diagnosis. The symptoms got so severe, I wasn't really able to eat. I was in such a lot of pain when I was trying to go to the toilet. I had started to get a lower back pain, which again got progressively worse and worse. So yes, subtle symptoms at first, and then it just got to the point where I had no quality of life at all. I had, I would say, really inconsistent bowel habits towards the end. Maybe about 6 months before diagnosis, it would either be very loose or I wouldn't be able to go at all. The blood in my stool only really happened right at the end.
So if you have one or more of those symptoms, because we don't need all of them, and you go to your GP, what happens next?
So if you go to your GP and he or she is concerned that one or all of these symptoms might be due to bowel cancer, you'll be referred in to a specialist in the hospital for a test called a colonoscopy.
And what's that?
So colonoscopy is a test where a little thin tube is put in with a light and a camera into your back passage, and it goes all the way through your bowel and looks for things that are abnormal. If at the time we do see something that is abnormal, a biopsy might be taken. Biopsy is a sample of tissue that can tell us if that abnormality contains cancer cells.
And if they did find cancer, what other testing might be needed?
So whenever we find a cancer, we then need to work out if that cancer is spread or not. So you are likely to have more tests, such as a CT scan of the whole body and sometimes an MRI scan.
So what are the stages of bowel cancer?
So there are a number of different staging systems for bowel cancer, but I think the easiest one is stage 1 to 4. So stages 1 and 2 are called early bowel cancers.
And where would the cancer be?
That's where the bowel cancer has remained within the bowel and it hasn't spread outside of the bowel wall or into the lymph nodes.
But what are lymph nodes?
So that's an interesting question. There are two main ways that things can move around our bodies. One is the blood circulation that everyone knows about. The other is the lymphatic system. So we can think of lymph nodes as stations along the lymphatic system that cancers like to spread to. And they're often the first place that cancers spread to. Stage 3 bowel cancers are called locally advanced cancers.
But where is that exactly?
So locally advanced bowel cancers are cancers that have spread through the bowel wall and into the surrounding tissues, or cancers that have spread to the local lymph nodes nearby here. When the cancer cells have got to the lymph nodes, they can then spread to other parts of the body through the lymphatic system. And advanced bowel cancers are when the cancer is spread to other organs, such as the liver and the lungs.
Back to Natalie for more on her bowel cancer journey. How did you get referred and have your diagnosis?
So after really quite a few visits to the GP over the course of a year, they put me on a 2-week cancer pathway. At that point, they also mentioned that they thought it was ulcerative colitis. So I was seen within 2 weeks for a colonoscopy, and I saw my cancer on the screen in front of me, and the room went very quiet. I don't think anyone was expecting it. I definitely wasn't. But I knew as soon as that room went quiet that it was cancer.
What are the treatment options?
So the treatment options will depend on the general health of the patient and the stage of the cancer. And your cancer team will decide on the best treatment option. But for early and locally advanced cancers, if we can, the treatment is surgery to remove the cancer in the first place.
What type of surgery would you have? What does it involve?
So the surgery is largely dependent on where the cancer is. So for example, if you have a cancer on the right side of the colon, then the surgery will be a right hemicolectomy, which will remove this part of the bowel. At the same time, the surgeon will also remove some of the lymph nodes that we talked about. If those lymph nodes have got cancer in them, when we look at the specimen under the microscope after the operation, you may need some treatment.
So if you have part of your colon or even part of your rectum removed, does that affect how you're going to do a poo?
It's a good question. Thankfully, for most patients, not really. When we remove part of the colon, we can join the remaining pieces of the colon back together again, and you can poo normally. But in some cases, the surgeon may want to bring a stoma out.
And what's a stoma?
So a stoma is a connection that the surgeon makes during the operation between the bowel and the skin on the surface of your tummy. Stomas can be put in for a number of reasons. They can be temporary or they can be permanent. Temporary stomas are usually put in to allow the new join in the bowel to heal up, and then they can be reversed later down the line, so you can be joined back up again and you can poo normally.
Whether or not you had a stoma, that seems like quite a big surgery.
Yes, it is a big operation and it will require several days in hospital and quite a long recovery. And your surgical team will discuss all of this with you.
Can you explain what chemotherapy is?
Chemotherapy is drug treatment that destroys cancer cells. And in bowel cancer, it can be given as a tablet form or an intravenous form, which means it goes through the veins. It can sometimes be given after the operation and sometimes be given before the operation. If lymph nodes are found to contain cancer cells during the operation, the chemotherapy is given after the operation to reduce the risk of the cancer coming back.
What about radiotherapy?
So unlike chemotherapy, which travels through the bloodstream, radiotherapy is high-energy X-rays that start from outside the body and are targeted towards smaller areas of cancer cells. So these 3 cells here are cancer cells. These 4 cells here are healthy cells. The radiation beam will come in and target this area. As you can see,
I've got a healthy cell in the middle of that.
exactly, however hard we try, even with the best radiotherapy techniques, we are still going to get some healthy cells within that field. What we hope is that the radiation will kill the cancer cells, but not the healthy cells, and the healthy cells will recover.
And what kind of side effects might that lead to?
So radiotherapy is typically used for rectal cancers, which lie in the bottom part of the bowel, and usually to shrink the cancer before the operation to make the operation more successful and prevent the cancer from coming back in that area in the future. But because of where it's located, we often see problems with going to the toilet or with bladder, and sometimes in the longer term, late effects of radiotherapy, which can also affect your sex life.
What about other types of treatment?
So there are also targeted therapies. These are treatments which can target the growth of the cancer cells and the blood vessels and can be used on their own or alongside chemotherapy. We can also use immunotherapy to treat bowel cancer, and this is where the body's own immune system is trained to recognise the cancer cells and attack them.
Now, unfortunately, nothing's perfect. So what are the side effects of treatment for bowel cancer?
So the different treatments for bowel cancer will all have different side effects, and your cancer team will go through that in detail with you. After the operation, you will feel some tummy pain. You may get some constipation or more commonly diarrhea, which may last for a few weeks before you start to get better. Chemotherapy has a number of different side effects. Sickness, tiredness are very common. One of the most important things with chemotherapy is the risk of infection as well, because it can lower your immunity. And your cancer team will explain all of these side effects to you clearly, and be assured that we have a number of different ways we can help to manage them.
Thank you, Dr Neel. Earlier, I spoke with Natalie about her experience with bowel cancer.
So my cancer was diagnosed at advanced stage, so it had moved beyond the bowel. It was actually, it had grown through my vaginal wall. It was pretty much filling my pelvis, and it was inoperable. So in order to shrink it and hopefully give me more time, I started on a course of chemoradiation at the same time. I found it really, really difficult, but then the waiting was really hard when they were like, it's going to be about 3 months till we can see if that tumour's breaking down at all from the radiation. And I was thinking, 3 months, oh my goodness. Mentally, that was really, really hard.
And then what happened next?
So I was really fortunate that the tumours responded very, very well to my treatment. It was a very aggressive year of treatment, and they told me that I was at that moment eligible for a surgery.
And tell me now, what's your health like now?
Miraculously, amazingly, and thankfully, I am cancer, well, no evidence of disease. I'm so grateful because it's something that nobody expected me to get to that point when I was diagnosed. So it's absolutely amazing. You know, my story is one of many stories of young cancer patients, young people with bowel cancer. And every story is different. Everybody is different. Every outcome is different. And I think if you're going through cancer right now, what you're doing is enough. You are enough as you are. You don't have to be anything more. Just show up, keep trying, and really hold on to that belief and that hope, because that will help you through some really dark times.
Thank you so much, Natalie, for sharing your experience with us. And thank you, Dr. Neel, for those fantastic explanations. Remember, the main symptoms of bowel cancer are blood in your poo or on the paper, a change in your bowel habit that's new for you and lasting for more than 3 weeks. But any symptoms that are ongoing, unexplained, or unusual should be checked out by your GP. It might not be cancer, but it's always better to get it checked. For more information or support, call 0808 808 0000 or visit macmillan.org.uk. Before you go, if you found our conversation on bowel cancer insightful, helpful, or useful, please don't forget to hit the subscribe button. You can also like this video and share your thoughts or questions in the comments below. Thank you so much for watching.